Hi there, Dr. Kerry Yerkew here. I'm a chiropractor in Kelowna. Today I'm talking about stretches for discs, in particular the lower part of the spine called the lumbar spine, and conditions like degenerative disc disease, degenerative joint disease, or osteoarthritis. Now the disc is the shock absorber that sits between the bones and should take up about a third of the height of the bone. So they're actually quite thick and they have a doughy outside called ligament and a fluid in the inside called the nucleus. And it's much like a jelly donut. And these discs are shock absorbers for the bones and spacers that allow the nerves to come out between the bones and go to various parts of the body. In particular, we're talking about the lower spine today, so we'll be talking about sciatica. Now, when the discs aren't working right, you can get a lot of pain in the lower part of your spine, but it can also radiate down the legs because these nerves that come out between the bones are called sciatic nerves, and that can cause a condition called sciatica where the pain travels down the leg as far as the tips of the toes, and it can be on one leg or both legs, causing a lot of pain radiating away from the area. Also, problems in this lower lumbar can cause pressure on the sympathetic and parasympathetic nerves in this area, and they go to the abdomen and the pelvic region, controlling the bowel and bladder. Last, the muscles in this area tighten and contract on one side, stretch on the other to accommodate for misalignments in the spine and poorly functioning discs in the lower lumbar region. As a chiropractor, as the patient starts to feel better with the chiropractic treatment in the clinic, I like to give stretches for the patient to do at home. And ones like this where you bring your knee up to your chest on the same side, so going to the same shoulder, and then a variation of that would be pulling the knee up to the opposite shoulder and holding that for about 3 to 5 seconds. Usually I'll get people to do both sides, so they'll do the left side and then the right side separately, and eventually I'll get them doing both sides together, bringing both knees up to the chest and holding that for 3 to 5 seconds and doing that 8 to 10 times. Often I'll give 2 to 3 stretches for the patient to do in between treatments. And I like the happy baby as well because you're lying on your back, it's very passive. Your hands are on your feet, or you can grab your calves if you can't reach your feet, and just pulling the legs into your body, opening up the space between the bones where the discs are and the lower part of the lumbar spine. I would hold this for 3 to 5 seconds, and I would do this 3 to 5 times in the morning and then in the evening. I like this one called the frog. It's a little bit harder to do, but being on all fours and just the legs separated a bit, it just stretches out the lower part of the lumbar and the hip region right here where the sacroiliac joints are. It's very good to open up the lower part of the back and provide a different type of stretch than the one I just showed you. Now, as you get good at those simple stretches, usually I will give the patient more progressive stretches to do. And again, check with your health professional before you do any of these stretches, but I'll go to the level 2 stretches with the patient next. So one like this called the goddess, where the patient has their legs out and they're squatting down, it can really help to open up the lower part of the lumbar and the discs, as well as provide some stability and strengthening to that area. Then adding in a twist like this when you're in the goddess position is good because it works with the rotation of the spine, and often the discs are very important in the rotation of the lumbar spine. Again, holding for 3 to 5 seconds one way and then 3 to 5 seconds the other way. I would do 8 to 10 repetitions of this, usually doing 2 to 3 exercises in each set. I like this one, the gorilla, really easy to do, very passive stretch. Just bending at the waist, hanging down to the ground with gravity, trying to relax your upper body, gives the lower back some traction and opens up the spaces between the bones, stretching the discs. Next is the downward facing dog. I call this again a level 2 exercise where the patient is progressing. You can keep your feet on the floor or lift your feet up, whichever is more comfortable like this. And then just have that V shape in the back, stretching out the connection between the spine and the pelvic area. Holding this for 3 to 5 seconds, doing this 8 to 10 times, but be careful you don't feel any dizziness because your blood pressure might change as the blood flows more up to the head region from the heart. I like this one, the crescent lunge, where one foot's forward, the other one's back, reaching up in the air, holding this for 3 to 5 seconds, doing both sides 8 to 10 times. And then once you get good at that, you can add this variation, this crescent lunge twist, where you're doing the crescent lunge and then you're just twisting in the low back. That adds a little more dynamic range to the back. It stretches the discs a little bit more in those muscles. And just hold this for 3 to 5 seconds and then do both sides. Now, when you switch to the other side, of course, you're going to bring the right leg forward, the left leg goes back, and then you twist in the opposite direction. Now, I'm just going to show you a couple level 3 exercises. These are more for strengthening the spine. So as the pain is reduced in the clinic, the patient's doing stretches at home, then they progress from level 1 to level 2. The next step is to do strengthening for the back. So we want core strength and stability, basically to hold the bones in place, hold those discs and support them. And this way we're going to have a good long-term outcome. So doing a full plank like this one at the top, holding this for 5 to 10 seconds at the start, and then doing, I would do 5 to 10 repetitions of this. And then the forearm plank with the elbows on the ground. This one's a little easier, I find, than the full plank. So you could start with this one, the forearm, and then progress to the full plank, holding this 3 to 5 seconds, and then doing 5 to 10 repetitions of this one. The other one that I really like, more for the abdominal region in the front part of the spine, is the hollow hold. You start on just lying on your back. You put your arms up at a 45-degree angle, legs go up at a 45-degree angle. You can contract your abdominal muscles and just hold that contraction for about 5 seconds. And I would do this 5 to 10 times. And as you get good at it, you can go up in repetitions or even duration of time. But check with your chiropractor first. And if you're a patient of mine, just check with me in the clinic at your next appointment. So there you have it. Some very good exercises for the discs. Level 1 stretching, level 2 stretching, and then core strengthening exercises to help the discs, to support them, help them heal, help them get their elasticity back in conjunction with chiropractic care. If you have any questions, please let me know. You can always drop them in the comments or ask me at the next appointment. Please like this video, follow me on social media and on YouTube, and I'll talk to you guys soon.